So we've invited a prominent infectious diseases specialist to help you navigate your choice. Dr. Lynora Saxinger, so good to have you right here in studio. We haven't spoken about this in a while. I get the sense that there are still people who say, even though we don't talk about it a lot, I'm tired of the COVID conversation. Some people have put it in the rearview mirror already. What do you say to them about the importance of tuning in at this moment?
I think that right now is a really important time for people to tune in, and I know a lot of people kind of probably checked out after their second vaccine dose, honestly. But for those individuals, I think it's very important that they consider the new shot as a really significant upgrade to what they've had before. The virus has actually changed over time enough that the protection from prior shots and even early infection are much less than it was before. And so if you want to be protected from infection this fall, it would be very important for people to get the XBB boosters.
We've been asking questions of our viewers. Send us your thoughts. We got one from a man named Bob Younger who said, I don't see a need for the shot. Makes sense if you're going to be in a hospital or an old folks home on a regular basis, though. Can you help us and him navigate this? What would you say to Bob about who needs this new vaccine?
Right, so the new vaccine is going to be available for everybody, essentially, age 6 months and up. And so it's going to be very broadly available, and the recommendation is to get it because it appears to be very safe, and we expect it to be effective at reducing the risk of getting sick this fall from COVID. I think the groups where it's particularly important and are really pulled out for all the public health groups are people who are at high risk of severe disease. And so people who are immunocompromised, people who are older, that's a very big risk group, and we've been seeing increasing severe cases in older people, people with multiple medical conditions, because those are the individuals who are still ending up in hospital, even now. So the risk is much, much less than it was, but it's still there. People who meet that profile should really prioritize getting a vaccine when it's available. For everyone else, it's kind of like the flu shot, where it's a recommendation and your personal circumstances and beliefs play into the decision, but that everyone should feel comfortable and encouraged to get it.
So what happens if you had the bivalent, you had the first one, the second one, the third one? Does any of that help protect you now? Because for those folks, it might have been 6, 8, 9 months since they've had a shot, and yet they'd had many of them. Is there anything left to protect them?
Yeah, it's kind of tricky to describe, but what happens is the protection against severe disease from both, previous vaccines and from infections is actually pretty well maintained. And so there's a level of your immune system which has learned very well and is likely to protect you against severe disease, or at least reduce the risk of severe disease. The part that seems to weaken more quickly is preventing infection at all. And so that's why we're seeing people who get kind of more of a nuisance infection or a moderately severe infection, but don't progress the way that we were seeing, in the bad old days of being ill enough to require oxygen and hospitalization. And so that bank of immunity that people have built up with all of their various vaccines and maybe exposures if they survived infection really has been very important. And that's why COVID is the way it is right now. That's why we're not seeing it the way we used to. That is the reason. Okay, so one last thought. Let's talk about this new strain of COVID. We do have another viewer. Andrew Petru says, how severe is this new strain? Is it like a cold? Is it like the flu? So what is the personality of this new beast? The strain that's becoming more dominant now is the EG5 strain, and it's kind of taking over the lion's share of what's circulating. It is part of the entire Omicron family. So everything that we've seen since basically January of 2022 has been in the Omicron family. But, the individual substrains, if I can call them that, have been changing over time, and they get farther away from the structures that our antibodies from the vaccines recognize. And this new one, each one that becomes more dominant actually probably is a little better able to outcompete the other circulating viruses. So it has a bit of an advantage in terms of getting around immune defenses and causing infection. It does not seem to be, by itself more aggressive or more severe. But like all of the Omicron strain viruses, if you are at higher risk, like if your immune system is very low, for example, this virus is still very capable of making people very ill. And the reason that we don't see that as much is because of the vaccination campaigns.
All right, Dr. Saxinger, thank you for coming in. We always appreciate it.
My pleasure. It's nice to be here in person.